The history of uterus transplantation is a significant chapter in the evolution of reproductive medicine, offering hope to women with absolute uterine factor infertility, which is a condition where a woman either lacks a uterus or has a non-functioning uterus, preventing her from carrying a pregnancy. Here is a detailed exploration of the development and milestones of uterus transplantation. Early research and animal models 1960s–1990s. Research on uterus transplantation began in animal models long before human trials. Early experiments focused on understanding the biology of uterine transplantation and pregnancy in various species. 1960s–1970s. Initial studies were conducted on rodents, with the aim of determining whether a transplanted uterus could maintain blood supply and function normally. However, these early experiments faced issues such as tissue rejection and failure to achieve successful pregnancies. 1990s. By this time, researchers began attempting uterus transplants in larger animals like sheep, pigs, and non-human primates. These models were essential for refining surgical techniques and studying the immune system's response to the transplanted organ. While some successful pregnancies were achieved in these animal models, there were still numerous challenges, particularly related to immunosuppressive drugs and the risk of organ rejection. The first human uterus transplant 2000. Saudi Arabia, 2000. The first known human uterus transplant was performed in Saudi Arabia by Dr. Her team. A 26-year-old woman who had undergone a hysterectomy received a uterus from a 46-year-old live donor. Initially, the procedure seemed successful, but complications arose due to blood clots, and the uterus had to be removed after 99 days. This case demonstrated the feasibility of the procedure but highlighted the need for further development in surgical techniques and post-transplant care. Swedish breakthrough 2012–2014. Sweden became the leader in successful uterus transplantation under the guidance of Dr. Mats Brandstrom at the University of Gothenburg. 2012. Dr. Brandstrom and his team performed a series of uterus transplants on 9 women with absolute uterine factor fertility. In these cases, the uteri were obtained from living donors, mostly mothers and close relatives of the recipients. These transplants marked a significant advancement due to the innovative approach to live organ donation. 2014. The first baby was born from a transplanted uterus in October 2014, marking a major milestone in reproductive medicine. The mother, a 36-year-old woman who received a uterus from a 61-year-old friend, delivered a healthy boy through a planned caesarean section. This case was the first documented successful birth after uterus transplantation, showing that the transplanted organ could function well enough to support a pregnancy. By 2019, at least 8 babies had been born from the Swedish program. Advances with deceased donors 2018. Brazil, 2018. A new breakthrough came when a woman successfully gave birth after receiving a uterus from a deceased donor. This procedure was performed at the Hospital das Clínicas in São Paulo by Dr. Donny Asienberg and his team. The donor was a 45-year-old woman who had died from a stroke, and the recipient, a 32-year-old woman born without a uterus Mayer-Rokitansky-Kuster-Hauser syndrome, delivered a healthy baby girl. The use of deceased donors is a significant advancement because it could make uterus transplants more widely available and eliminate some of the ethical and logistical challenges associated with live donors. Ongoing developments and global expansion. Since these initial successes, uterus transplantation has continued to evolve, and various countries have started conducting trials and performing transplants, including the United States, India, China, the UK, and others. United States. In 2016, the Cleveland Clinic performed the first uterus transplant in the U.S., though the uterus had to be removed due to a fungal infection. However, further transplants were successful, and the first U.S. baby born from a uterus transplant was delivered in Texas in 2017. India. In 2017, India's first uterus transplant was performed in Pune. The recipient was a 21-year-old woman who received the organ from her mother. United Kingdom. In 2023, the UK saw its first successful uterus transplant, performed by a team at the Churchill Hospital in Oxford. The recipient's sister donated the uterus, and the procedure was a major step forward for uterus transplantation in the country. Ethical considerations. Uterus transplantation presents unique ethical considerations. These include 1. Live donor risks. Live donor uterus transplantation poses risks to both the donor and the recipient. The surgery is complex, with the donor undergoing major surgery that can have complications, including infection, blood clots, and prolonged recovery times. Ethical debates continue about whether it is justifiable to expose live donors to such risks. 2. Immunosuppression and pregnancy risks. Recipients of uterus transplants must take lifelong immunosuppressive drugs to prevent rejection of the transplanted organ. These drugs carry risks for both the recipient and the fetus, including infections and potential birth defects. Close monitoring is required throughout the pregnancy. 3. Deceased donors. The use of deceased donors helps mitigate the risks to live donors, but there are still challenges in organ preservation and ensuring that the transplant surgery is successful. Moreover, deceased donor transplants are limited by the availability of suitable donors and logistical challenges like organ transport and timing. 4. Temporary nature of the transplant. Uterus transplants are considered temporary, meaning the uterus is typically removed after 1 or 2 pregnancies to reduce the need for lifelong immunosuppression. This adds complexity to both the surgical process and the ethical considerations around such a life-altering procedure. Conclusion. Uterus transplantation is a pioneering procedure that offers women with absolute uterine factor infertility the chance to experience pregnancy and childbirth. While the surgery is still in the experimental phase and comes with significant risks, the success of early cases has led to growing optimism about the future of this treatment. As surgical techniques improve, and more women undergo successful transplants, it is likely that uterus transplantation will become an increasingly viable option for women seeking to overcome infertility caused by uterine absence or dysfunction.